The NHS is probably today seeing the greatest financial pressures it's seen in its entire history, and it's responding to those challenges. Since 2011, the NHS reports to have made £800 million worth of savings. There have also been important improvements against key measures of public and population health, and in some key measures of quality and safety. And the introduction of 3 integrated plans has brought an important focus to financial service and workforce planning. However, with demand and capacity pressures exacerbating the problems of the finances, the NHS has struggled to sustain performance in some key areas, most notably waiting times for treatment in emergency departments, for elective treatment and for cancer treatment are typically longer than they were back in 2011. The report points to a need for greater realism in the way the NHS plans around the impact of financial pressures on key performance targets. The report also shows that whilst there are pockets of innovation, these have not yet been translated into the wholesale transformation of services that the NHS knows is needed to ensure safe and cost-effective services. Making changes to NHS services can be politically challenging and can be time-consuming. However, with continued demographic pressures, rising demands and continued austerity, the case for change is clear. The key themes of the emerging prudent healthcare agenda need to be taken forward, and the overall pace and scale of change will need to be increased.